Again, this is Kongo TV. I am your host, Mamadi Sao. Of course, I have my guest here, Musa Ture, who is a native of Sandu, Konkoba. Today, our topic of discussion is centered on diabetes. Of course, he has spoken in the local language Mandinka, and I believe it is clearly understood in our first episode. Now, our second part of interview will be centered on English language. And of course, Musa will tell us what is diabetes in the first place and what are the signs and symptoms of diabetes.
Okay, thanks, Mr. Sao, for having me here. It's a pleasure to be here and to be the first guest of this interview, Jata Kenya series.
Okay.
And I am glad that, you have that, motivation and eagerness to come and interview us on issues surrounding health. I think it's very important.
Very well.
So our topic of discussion is diabetes.
Okay.
Yeah, so diabetes is a non-communicable disease. It's a disease that is it's a global concern. Usually it occurs, or people tend to, or it is associated with hypertension and other non-communicable diseases. So diabetes occurs when there is reduced ability of your body to utilize glucose, and as a result there will be increased blood glucose level. There will be more than what is necessary to understand in your system. So this is basically what diabetes is, like when there is increased blood glucose level. Yes, and there are issues, or there are factors that are responsible for
this. So what are the types of diabetes and what are the factors responsible for diabetes?
We can have so many types. But we have two main types. That is types 1 and
Type
2. We have other types like gestational diabetes, which usually occurs in women that are pregnant, or that are in their times of pregnancy. But this one, types 1 and type 2 are the most common types of diabetes. But of the two, types 2 or type 2 diabetes is more common, or is more prevalent than type 1. So type 1 occurs when your pancreas is the organ that is responsible for producing insulin. Insulin is a hormone that is responsible for regulating your blood glucose level. So pancreas is the organ that produces insulin. So when there is that inability of the pancreas to produce insulin, or the insulin that it is producing is insufficient. So this will lead to type 1 diabetes. Yes, and also it occurs across all age brackets. People would say that diabetes does not happen in kids, but this particular type of diabetes can even happen in children. Type 1 diabetes. Because it has to do with the pancreas. Either you have issues with your pancreas, the pancreas is inflamed, or there is some underlying factors that necessitated the surgical removal of the pancreas. So all these things could lead to type 1 diabetes.
So you can move to the signs and symptoms of diabetes, because you have to summarize it. We don't have more time with us.
Signs and symptoms of diabetes, there are many. But we have signs that are more common than others. So one of the signs of diabetes is what we call polyuria. Polyuria means increased frequency of passing urine. So this is one of the signs of diabetes. When people are diabetic, they tend to urinate more than they normally do. Another one is that what we call polyphagia. That is increased desire for food, or increased longing for food. You realize that people that are diabetic, they always want to take food, and they will be taking in food, but that would not usually quench their hunger. They would still be complaining that they are hungry. So that one is there. And also you will, when you are diabetic, or people that have diabetes, they will lose sensation in usually their peripheries, like their limbs, their feet or their hands. They tend to lose sensation there. So as a result, when they get wounded there, sometimes it takes time before they detect it. You understand? They would just be there all of a sudden and realize that the ulceration is just expanding like that. So all of a sudden they would see, and they would just worry, how were they able, or how did they sustain that particular injury? But it would be there because they lost sensation due to neuropathy, because the nerves that will be responsible for sensation in that area, they are dead, or they are destroyed. So as a result, they will not be feeling in that area. So that is one of the science also. Yeah.
Thank you so very much, Musha Ture, for giving us the science and system. Of course, you are watching Konku TV Live. Mamadi Sao, the host, and I have Musa Ture as my guest. We're talking about diabetes as our main topic of discussion today. Inshallah, Musa, let's now move to the lifestyle management. So, what are some of the things that you think are required of people to do in order to at least minimize or manage diabetes? And at hospital level, the testing and diagnosis of hospital at the hospital level, what do they do?
Okay. Yeah. Lifestyle management is very important when it comes to diabetes prevention. Yeah. Like we need to watch the kind of foods we take,
eat, okay.
And we need to change our lifestyle. Yeah. Like we need to minimize our consumption of sugary foods,
Okay.
like fast foods, add food like food items that have added sugar, and some of these flavored drinks because they have sugar. So we need to minimize it because all these things are glucose rich food, so they have glucose. So when we take it, we increase that glucose in our system. So these are some of the things we need to minimize, and also we need to be people who would embrace exercise,
Okay.
because exercise is very fundamental.
Okay.
When we exercise, we enhance the way our muscles and parts of our body they take in glucose, which is which is the main thing that is a concern here. So we exercise helps us to take in those things that we have, that those glucose in our system. Yeah, so exercise is very important.
Okay.
And we also need to avoid being sedentary, meaning we are always confined to one place. We don't do much exercise. We will be like, even like from one place to another, that you can walk or you can cycle.
Exactly.
You will just take a car or things like that. So we need to try and work on all those things. Yeah, and also we need to take in more like vegetables, legumes, and others, and foods that are rich in fiber. So these are things that are really good for our system, instead of consuming like foods that are like excessively sugary and things like.
In a situation where somebody has diabetes, what are some of the implications or risk factors associated with it?
Yeah, like risk factors, like when risk factors are some of the things like that can be linked to what I just discussed here. Yeah, like one of the risk factors of diabetes is like obesity. Obesity means people that are like fat like that. Yeah. So although there are like clinical definitions of it, but like usually we associate it with people that are fat. You understand? So that is one of the risk factors. If you are fat or you are obese, there is like that chance that you may develop diabetes if you don't work on yourself. So you should work on trying to lose weight and trying to put in more exercise and things like that. Yeah, that one is there. Smoking, smoking also is a risk factor. If you are like you're a smoker, you are more predisposed to getting diabetes than other people that don't smoke. And also you have this thing like family. When it is in your family system, you are likely to have diabetes if you don't observe other things, like you don't exercise, you don't watch the kind of foods that you take in, you don't work on your like general lifestyle like that. So you are more predisposed to having diabetes than other people. Yeah, so these are some of the risk factors that are associated to diabetes.
Yes. We are almost at the close end of the interview. So the next question that I would want to ask is that, are all diabetic patients required to take insulin, and how do you take insulin at the hospital level?
Yeah, like I explained earlier in the other part of the interview, like people that have diabetes, they will be on insulin therapy. Like they would be giving them insulin, to make sure that like they work on their blood glucose level. That one will be there, and they would be giving them some medications.
And how is insulin administered also?
Yeah, insulin generally is administered through IV, that is intravenous. Like when you go to the hospital, you see some patients, they will be having like something that is fixed to their hand like this. We call it cannula. So that one, there would be something dripping. Usually they will have insulin and they will hang it somewhere. So that insulin will be like getting into your system. That is the way they administer insulin at the hospital. And they will also be giving them some like medications that will try to lower or reduce their blood glucose level. They are at the hospital level.
So why is it that insulin is not taken oral?
Yeah, usually there is a like biomedical reason for that. They prefer to give insulin through IV than giving it to them like orally. Yeah, the main reason is that like insulin is a hormone or is proteinous in nature, and we have enzymes in our system, particularly in the stomach, that work or that work on proteinous things, like the foods that we take in that are rich in protein. They will try and break them down. That is to work break them down to more absorbable items. Yeah, so insulin being a protein, when it is administered orally, so it may come in contact with these enzymes in our stomach. So when it comes in contact with these enzymes, they could break down, or they could affect insulin. They could try and they could disintegrate it or tamper with its concentration. So this is the main reason, and also uh, the uh, the they prefer to give it IV, like, because IV intravenous, yeah, is straight. Because when it is given orally, it will have to pass through many barriers.
That's true.
You understand, to get into the system and finally into the blood system. But when you give it IV, it just goes straight into the bloodstream. So that one, the action is even faster than you can imagine.
Yes. Thank you so very much, Musa, for having been interviewed here on Konku TV as the first person to be interviewed on this segment called Jarikendeya program, which is specifically centered on health issues. So we really appreciate your comment, and please, can you tell us, talk to the viewers, your impressions and actually your final words, inshallah.
In English?
Just in English, lah.
Okay, thank you so much, Konku TV, for interviewing me on this important topic. Yeah, and I would like to thank our viewers and all those that are following the program to keep following and subscribing to Konku TV. This TV is here to stay, and it will provide you with contents like this that are very important, are very necessary in raising awareness in the society. So I would like to thank you all for following us on the program here. And I would like to advise you to work on your lifestyle. It was try and minimize the kind of food that we take in, or kind of like we work the kind of foods that we take in. We minimize our sugar consumption. We try and do exercise as much as we can. And inshallah things are going to go fine. Yeah, because this disease is actually a global burden. It's not only in the Gambia here, it is just worldwide. Diabetes and hypertension, these are issues that really affect the world. Yeah, so I would like to thank you all for following us on the program.
All right, thank you so very much, Musa Toure, and would be a medical doctor, of course. Allah baraka bake atel men kan jibe nyin tembe na Konku TV. Ali ya katabake ali subscribe ko ngafnya men ka video nyin ta fran kata ka janjande YouTube kata Facebook ko nyin kamala ko na fami be fo askembe. Allah baraka bake nal bade malamo Mamadi Saw for ko